examinations. We need to make sure that we can land into somewhere around about the size of 2 tennis courts is what we're ultimately looking for. Make sure there's no lines, any of the small BT lines or the small power lines that we could get caught out with.
I think so. We go for the road. Right. Focus, my friend. Okay, that's me off top. The door's now secure. Okay.
Paramedics safely on the ground, pilot Sean flies straight off to refuel. While JP and Wendy finally get a look at their patient, Ian. And, with the help of the local doctor and ambulance crew on the ground, come up with a treatment plan.
Having the knowledge that he'd fallen from such a height, there's a lot to consider. We want to know whether the patient is critically ill or stable, and we want to know that quite fast. He was quite cold and he's been lying on the ground for quite a long time, so we want to get him covered up and into a better situation than he was when we arrived.
There's little more the paramedics can do out here in the open. With these injuries, Ian needs to be transferred to the nearest trauma unit in Glasgow. JP calls it in.
It's fallen 8 feet. It's a small impalement, but we're creating rib fractures, posterior rib fractures. At the moment, the patient is stable. We're going to load him onto the back mattress, to the ambulance, and then to the secondary landing site.
All these injuries are potentially serious until to